Okay, let's be real for a second. When you're looking at health insurance plans and you see one called high deductible, you're probably scrolling right past it, right? I mean, the name itself just screams expensive and risky. But what if I told you that name is maybe one of the most misleading things in all of Medicare? Today, we're going to pull back the curtain and show you why this plan might just be the smartest, safest, and most cost-effective choice you can make.
Right. That's the first thing everyone thinks. High deductible. It just conjures up these images of huge, scary bills you have to pay all on your own before your insurance even kicks in. And you know what? That's a totally logical reaction. But here's the twist, and it's a big one. What if that name, the thing that sounds like its biggest weakness, is actually its greatest strength?
So this is the core idea, and it's going to feel a little backward at first. What if this plan, the one that sounds like a total gamble, is actually the one that lowers your total financial risk for the entire year? I know, it sounds kind of crazy, but the numbers don't lie, so let's dig into the actual math.
Let's just start with the single most important number in any health plan, your absolute worst-case scenario. This is your maximum out-of-pocket, or MOOP, the most you could possibly pay in a really bad year. Now, with a lot of popular Medicare Advantage plans, that number can climb all the way up to and even past $9,000. But the high deductible supplement? Well, its cap is dramatically lower.
Just look at that number for a second, $2,950. Now, the key here is to stop thinking of this as a deductible. It's not. It's a financial shield. It is the absolute ceiling on your medical spending for the whole year. No matter what happens, major surgery, long hospital stay, whatever, you will not pay 1 penny more than this for your medically covered services. It's a hard stop on your risk.
Okay, so that risk cap is pretty impressive, but that's just one piece of the puzzle, right? What about the total cost when you add in your monthly premiums? To really see the big picture, you've got to look at the full potential cost for an entire year. First, let's look at a super popular traditional option, a standard Plan G. On average, the yearly premiums run about $4,800. Then you add in the standard Part B deductible. That brings your total potential financial commitment for the year to just over $5,000, okay? Keep that number in your head.
Now let's run the exact same worst-case scenario math, but for the high deductible version. The annual premium is just a fraction of the cost, around $900 for the year. Then we add our risk cap, that hard ceiling of $2,950. And what do we get? The total potential annual cost is just over $3,800. That is a massive difference.
And here it is side by side. I mean, look at that. This is what's so wild. Even if you have the absolute worst health steer imaginable and you hit your spending limit, you can still end up over $1,000 ahead compared to the traditional plan. And why is that? It's simple. Your fixed costs, those premiums you have to pay every single month no matter what, are so much lower from day one.
So what's the smart way to handle this? You pay yourself first. You take all that money you're saving on the lower monthly premium and you just transfer it into a dedicated savings account. That becomes your own personal healthcare fund. If you need it for a co-payment, great, it's sitting right there. And if you have a healthy year and you don't need it, well, that money stays in your pocket, not the insurance company's.
Okay, I get it. The math makes sense. But the practical side of things can still feel a little nerve-wracking. Like, what actually happens when you show up at the doctor's office? Let's break down how it really works and bust some of the biggest myths out there.
This is it. This is the number one question, the one that freaks everybody out. Does this mean if you have a big hospital bill in January, you're suddenly on the hook for nearly $3,000 all at once, all by yourself? And the answer is a very loud, very clear no. This is probably the most important myth we need to bust. It is not like your car insurance deductible, where you have to pay a giant lump sum before anything gets covered. It's much better to think of it as an annual spending limit that only applies to your share of the costs.
So here's how it really plays out. Once you've met your standard, small Medicare deductibles, Medicare itself steps in and pays its share, usually 80% of the bill. You're only responsible for the remaining 20%. And every time you pay that 20%, it chips away at your cap. Once the total amount you've personally paid hits that $2,950 mark, you're done. You're finished for the year. From that point on, your supplement plan pays 100% of the rest. You are never, ever left holding the entire bag.
All right, on to the second big practical question. Is this some kind of weird niche plan that doctors haven't heard of and won't accept? Are you going to have a hard time finding someone who will even take your insurance?
The answer here is a huge yes. And honestly, this is one of the plan's greatest superpowers.
Because this is a supplement to Original Medicare, you have the freedom to see any doctor, go to any hospital anywhere in the United States as long as they accept Medicare. There are no restrictive networks to worry about at all, period.
So, let's zoom out for a second. We've seen how this plan stacks up against the traditional supplement, but how does it compare to the other big choice that a lot of people think about, which is a Medicare Advantage plan?
This little chart really lays it all out, doesn't it? The high deductible supplement is all about two things: giving you the lowest possible financial risk, that's that tiny cap, and total freedom to choose any doctor. Medicare Advantage plans, on the other hand, are more about convenience and perks. They'll bundle in your drug coverage, maybe some dental and vision. But that convenience usually comes with a much smaller local network of doctors and a significantly higher financial risk cap. It really just boils down to what you value most: rock-solid financial security and freedom, or bundled convenience.
You know what? Let's just do everyone a favor and officially rename this thing right now. Forget high deductible. This is a low-premium capped risk plan. That's not some clever marketing spin. It's just a literal description of exactly what it does. It keeps your monthly payments low and puts an ironclad ceiling on your total financial exposure.
So, to wrap it all up, what's the deal here? Well, by being willing to share in a small, manageable, and, most importantly, capped portion of your costs, you get some huge benefits in return: a lower total annual cost in almost any scenario, total freedom to see any doctor in the nationwide Medicare network, and a predictable, hard limit on your financial risk for the year.
And that really brings us back to where we started, with one final thought. It's a total flip of how we usually think about these things, but based on the actual numbers, you have to ask yourself, could the plan with the scariest sounding name actually be the single safest choice you can make for your wallet? It's a counterintuitive idea for sure, but it's one that is absolutely worth thinking about.